continued confusion.
I have requested more in-depth clarification.
Organizations shut down by public health orders question the province's justification as Alberta hits another daily record for new cases. Plus, restricting random police checks.
We are correcting a mistake from the past.
We'll detail what the province is doing to prevent racial profiling, why some minority groups are still skeptical.
First Nations people are sick of hearing empty words and promises.
And stocking the shelves.
Shopping local this Christmas is critical.
In hopes you'll soon be there. How local businesses are banking on the holiday season to weather the pandemic.
CTV Calgary, local breaking news with Tara Nelson.
Hello and thank you for joining us. We begin with breaking news tonight. It is a big one. Another leap in new COVID-19 cases. 1,105 cases confirmed tonight. That is the highest single-day number, another grim record. Also, 8 more Albertans lost their lives. This graph shows just how quickly the daily counts have risen. On October 1st, we had just over 18,000 total cases. We've gone through Thanksgiving and Halloween. Since then, the total now sits at 43,000. That means about a third of Alberta's total cases have been recorded since October 1st. Over that same period, we have gone from just over 1,500 active cases to 10,382. That's an increase of nearly 8,900 active cases in about 7 weeks. Now, the picture is a little better in schools. 50 schools came off the outbreak list today, and 14 more came off the watch list, including 13 in the Calgary zone. The school outbreak is declared over when there have been no new confirmed cases in the past 28 days. It has been 1 week since additional restrictions were put in place in Alberta, and we could be on the verge of further health measures. An infectious disease expert is warning the province is getting dangerously close to having to make some difficult decisions. As Brenna Rose reports, it comes as some Albertans are still trying to get clarification on why they aren't allowed to operate.
For the past 8 weeks, Calgary's Cool Choir has been allowed to meet in person. Spread out and wearing masks, but glad to be back together after months apart.
We're at a time now where people do need the arts. They need singing for their own mental health, they need community, they need laughter, they need friendship, they need music.
Rehearsals were brought to a halt last week as Alberta implemented new measures to try to curb the surging number of COVID-19 cases and hospitalizations.
There's been no outbreak, there's been no problems, everybody's felt safe. And there's no rhyme or reason, particularly when you consider that restaurants, bars, pubs are still open.
The choir's director hasn't been able to get clarification, but a Calgary infectious disease expert points to the lack of known sources for current cases in Alberta. 10,382 COVID cases are now active in Alberta, but the source of infection isn't known in 80% of them.
I think perhaps part of the issue is the interpretation of the data. So where we see, for example, a lack of hard data saying a specific activity is causing cases, I understand where people have a pushback on that. But then when we are also looking at the data and saying up to 3/4 of the cases we don't actually know where they come from, well, that doesn't exactly alleviate certain activities from potential lockdowns.
Although it hasn't been 2 weeks since the last restrictions were put in place, health experts, including Alberta's top doctor, have hinted at the potential for more.
Unfortunately, as cases continue to rise, as the ICU occupancy goes up, our options get more and more limited. We don't get that flexibility of trying smaller things and more focused or nuanced restrictions. Once we start reaching capacity, and we're getting close within the healthcare system, we may be forced with very broad restrictions.
And Brenna joins us now. Okay, Brenna, so where can we expect to go from here?
And you know what, Tara, I wish that there was a simple answer, but unfortunately there's not a one-size-fits-all approach. We do know that Dr. Hinshaw is scheduled to speak tomorrow, but at this point we're not sure if she will be announcing any additional restrictions. Now, keep in mind that experts have been telling us that it takes about 2 to 3 weeks to see any change in cases from when the restrictions are announced. So even if new measures are announced tomorrow, will be some time before we see cases potentially go down and those hospitalization rates decrease. Tara?
Okay, Brenna, thank you. When police in Alberta stop any person anywhere in the province, they must have a reason. Justice Minister Casey Madhu announced today a ban on the practice of carding. That's stopping